Americans have work to do. Americans want to work, and it's time for this House to work. And with that, Mr. Speaker, I yield back my time.
The gentleman yields back. Yeah. Under the Speaker's announced policy of January 5, 2011, the gentlewoman from Tennessee, Mrs. Black, is recognized for 60 minutes as the designee of the Majority Leader.
Thank you, Mr. Speaker. And I rise today with many of my freshman colleagues to talk about the impact of a very important bill, the Patient Affordability Act, or commonly called Obamacare, on our economy, our caregivers, and most importantly, the American people seeking care. Any day now, the Supreme Court is expected to announce its decision on Obamacare. And while I hope that the Supreme Court rules on the side of the Constitution and the American people, no matter what happens, the fact remains this law is bad policy. It's bad for health care, it's bad for the economy, and it's bad for the future of our country. The rhetoric of the bold promises used to pass Obamacare into law simply cannot be reconciled with reality. The more the law is implemented, the more the American people don't want it. The President's promises on quality of care, lower insurance premiums, no increase in taxes, and no effect on the deficit in just 3 years have been broken time and time again. Broken promise number one. President Obama said in March of 2010, and I quote, "If you like your doctor, you're going to be able to keep your doctor. If you like your plan, you can keep your plan." The reality is, President Obama's very own administration now estimates that the new regulation contained in Obamacare will force up to 80% of the small businesses to give up their current plans by 2013. The Congressional Budget Office also estimates that between 3 and 5 million people will be dropped from their employer-based coverage by the time the law is fully implemented. When I visited businesses in my district, I always ask, have you done the math? Will you keep your insurance or will you pay the fine? Time and time again, I get the same answer. We'd like to keep insuring our employees, but it doesn't make good business sense to do so. Yesterday, in fact, I participated in a field hearing in Murfreesboro, Tennessee, on the effects of the government regulation on the economy. And we heard from several business owners and state leaders. A gentleman by the name of H. Grady Payne of Connor Industries, which is a plant in Fayetteville, discussed the impact of Obamacare on his business. He said his company has about 450 employees, and he struggles each year to encourage them to participate in health insurance. The company has had to create different employee groups in order to create an employee base which would have 75% participation as required by most insurance companies. Now, Payne said that the non-discrimination provisions of the health care reform would prohibit this, forcing the company into several expensive options. It could switch from full insurance to self-insurance. It could expand the coverage to all employees and have the employee costs set according to the affordability formula, or it could stop offering health care insurance altogether, instead paying the penalty of $2,000 for each employee. Payne said any of these three options would cost the company more than $1 million compared to the current cost. I'll talk about other broken promises, but I would like to yield 5 minutes to my good friend Todd Young from Indiana, representing the 9th District of beautiful Bloomington. I yield him 5 minutes.
Well, I thank the gentlelady, my hard-working colleague from Tennessee, who's also a healthcare professional and quite conversant on these issues, and you speak with some authority. So thank you so much. I come from the state of Indiana. With internationally renowned medical device manufacturers like Cook Group in Bloomington, or smaller entrepreneurial companies like MedVenture in Jeffersonville. Indiana, in fact, is a global leader in the medical device industry. Scores of successful medical device businesses are headquartered in the Hoosier State, and they provide nearly 20,000 hardworking Hoosiers with good-paying jobs. Now, these jobs, by the way, provide wages that are over 40% higher than the state average. These are exactly the sorts of businesses we need to expand and grow right here in America if we want to create a healthy economy. I bring this up because the President's health care law, what most Americans now know as Obamacare, would shrink the number of American jobs in the medical device industry. This is because the law contains a 2.3% industry-specific excise tax that will cripple the sale of these medical devices. It would cripple the entire sector and hurt American jobs. Now, back in October, a bipartisan group of us from Indiana held a field hearing in Indianapolis to discuss this very issue with industry leaders. And the response from businesses was unanimous. This device tax would be, across the board, harmful to these manufacturers throughout the industry. Many admitted that they would have to move jobs to Europe. Now, when is the last time that we heard it was cheaper to move American jobs to Europe? For the sake of keeping these high-paying advanced manufacturing jobs here in the United States, this tax must be repealed. In fact, the medical device excise tax is so harmful to the American economy that the House voted just 2 weeks ago to repeal this narrow part of Obamacare. It's one in a long string of votes that we've cast in this House to repeal or replace a portion of this law. Now, there's a better way to address increasing health care costs than by imposing additional taxes on the American people. I say let's start over. If the Supreme Court doesn't do our work for us, let's repeal the Affordable Care Act. And then let's get to work and pass bipartisan legislation that would actually bring down the cost of health care, what this whole exercise was supposed to be about in the beginning. Our constituents deserve no less. They expect us to engage in this effort. I'm certainly committed to it. I know my colleagues here on the Republican side in the House are committed to it as well. And I thank the gentlelady again and yield back.
Thank you, Mr. Young, and I appreciate his comments about starting over. Certainly, we do feel that that is the direction that we need to go. As a matter of fact, we've had over 24 votes on repealing and replacing this very onerous bill that has affected our businesses, as has just been said. Now I'd like to yield 5 minutes to our class president, as a matter of fact, Austin Scott, who represents the 6th Congressional District in Georgia, and he represents Warner Robins. And so I yield 5 minutes to my colleague from Georgia.
Yes, ma'am. And my father, as you, is a healthcare professional, an orthopedic surgeon who came out of med school when I was just a child, and I spent a lot of time in a physician's office and in a not-for-profit hospital watching my dad take care of patients and helping them. And certainly that doctor-patient relationship is something that has been stripped away in this bill. But I want to talk about the numbers, not just the relationships right now, because I think it's important to reflect on what happened 833 days ago when then Speaker Nancy Pelosi told the American public that Congress must pass the bill so they could find out what was in it. Now, I have no doubt that the President, in his endorsement of the bill, surely he read it and knew exactly what was in it. And the Speaker of the House of Representatives, it would have been irresponsible for her to endorse a bill without knowing what was in it. And they had to understand that it would negatively impact our economy. And the gentleman who was just in the well talking about Americans wanting to go back to work, he's absolutely right. And the Republicans in this House have passed a tremendous number of jobs bills that would help put Americans back to work, help reduce the cost of petroleum in this country, and yet they sit over in the Senate idle, along with a bill that would actually repeal this national health care law that has kept us in a recession. Now, they forged ahead with this legislation instead of working on the economic issues that so many Americans needed them to work on, and quite honestly, despite the protest of the American public. They simply thumbed their nose at the American citizens, and that's why when it came time to go to the polls, 87 new freshman Republicans came to Washington. Districts where the President had gotten almost 60% of the vote. Those people, those Americans who understood that their rights had been stripped from them, absolutely rejected the President's health care bill. Now, 822 days since the Democratic-controlled House passed the President's health care bill, and I would remind you, it was just a few days before that when, in order to get the number of votes to pass it, he met with pro-life Democrats and assured them that in no way, shape, or form would abortions be funded in the bill. That was his commitment to pro-life Democrats to get them to vote for the bill. And obviously we now know that that wasn't necessarily true. We all know where the mandate has come out, that he has told people that he really doesn't care if it violates their faith or their religious principles. They're going to do what he says, not what their faith tells them to do. Certainly a direct violation of people's constitutional rights. Now, it's 820 days since the President signed it into law. There's been no recovery, and there could have been. And there's no ifs, ands, or buts about it. More Americans would be at work today, right now, if that bill had not been passed, and the sooner it is undone, the sooner Americans will be able to get back to work. 89 days since the Supreme Court began hearing oral arguments about the constitutionality of the law. 89 days. Now, Mr. Speaker, the American people began feeling the negative impact of this bill, quite honestly, as soon as it was passed on day one. And unfortunately, they'll continue to feel the impact of this legislation until Congress fully repeals and replaces it. Some more numbers for you. In the past year, the average cost of health care per active worker rose to $11,176. The increase was $800, almost $1,000 a month per worker. The employee share of premium contributions increased by 63%, and there was a 62% increase for dependent coverage. Yes, all of this because of the increasing cost and the mandates in the health care bill. 81% of companies said the health care law had increased administrative burdens on their human resources department, and they are not, in many cases, hiring people because of the unknown cost of the legislation. 1 in 6 firms said the cost of complying with the law is one of their top challenges in maintaining affordable coverage. Mr. Speaker, while it's my firm hope that the Supreme Court will find this law unconstitutional, which I believe it is, we must continue the effort to repeal and replace this bill. We can't wait for the November election, Mr. Speaker. The American people need this bill repealed right now. Madam, I yield the remainder of my time back to you.
Thank you so much, Representative Scott, for coming here today and talking about the negative impact on our economy. Certainly we know that that is true. I want to talk about broken promise number 2 and how this is a negative impact on our seniors. Broken promise number 2 is proponents of Obamacare claim that it would protect Medicare. That couldn't be further from the truth. The health care law cuts more than $500 billion from Medicare, and it threatens the choice seniors currently have in deciding which kind of health care best fits their individual needs. And thanks to Obamacare, Medicare Advantage enrollment will be cut in half by 2017. The only thing this law does for Medicare is ensures bankruptcy in 8 years. Now, instead of structurally reforming Medicare and building on what is working with Medicare Advantage, Obamacare further weakens Medicare's fiscal state and punts the difficult health care decisions to unelected bureaucrats. This is clearly not the way to preserve care for our current or future retirees. Real, sustainable reforms must be made for those under 55 in order to keep our promises to current seniors. This law hurts seniors today, and it stands in the way of protecting this program for our future children and grandchildren. And now I'd like to yield 5 minutes to a friend of mine from Las Vegas, Nevada, Representative Joe Heck, representing Nevada's 3rd District, who is a physician and a health care provider.
Thank you.
Yield 5 minutes.
Thank you. I thank my colleague from Tennessee and my fellow health care practitioner for heading up this most important discussion this evening. Mr. Speaker, I come to the floor today to talk about something that a majority of Americans actually already know. The health care overhaul that was forced through Congress on a party-line vote in the dead of night with special interest provisions like the Cornhusker kickback and the Louisiana Purchase is a bad piece of legislation that should be repealed. In fact, a recent New York Times poll showed that 68% of respondents want to see the law partially or fully repealed. It's no surprise that the American people are frustrated and want to scrap this law and start over. The law has failed to deliver on all of its major promises. We were told that the law would reduce costs, reduce the deficit, create jobs, and allow people who like their insurance plan to stay on it. Well, we now know that it has fallen far short of these goals as we continue to read stories and studies outlining just how harmful this law will be for patients and for the economy. We know that this law will not reduce the deficit. In March, the nonpartisan Congressional Budget Office released a report in which they projected the cost of the health care overhaul out to the year 2022. They found that the bill will cost $1.7 trillion between now and then. That is twice as much as the bill was originally intended to cost. And this, of course, would be added to a national debt of over $15 trillion. We know this law will hurt access to care for patients, especially our seniors. In addition to gimmick accounting that essentially cuts $500 billion from Medicare and disproportionately affecting Medicare Advantage beneficiaries, the health care overhaul established the Independent Payment Advisory Board. This board of unelected Washington bureaucrats, this Medicare IRS, will be handpicked by the administration to cut funding for Medicare. Make no mistake about it, the bill is very clear about the aim of this board, and I quote, "It is the purpose of this section to, in accordance with the following provisions of this section, reduce the per capita rate of growth in Medicare spending," end quote. The board will be unaccountable to the American people, it will be unaccountable to the Congress, and it will even be unaccountable to the President, and will stand between seniors and the services they receive from Medicare. As a doctor, I fear that when forced to reduce Medicare costs, the actions of this board will have serious implications for access to care for seniors. That is not what my constituents and the people of Nevada want in a health care system. We know that this law is going to increase health care costs for patients. As was mentioned, we just voted to repeal the medical device tax contained in the health care overhaul, one of many such taxes contained therein, that would have imposed a 2.3% tax on medical device manufacturers and was projected to increase taxes by $28.5 million over the next 10 years. This tax would result in higher costs for medical device manufacturers and would be passed on to patients in the form of more expensive medical bills. Increased costs for doctor and hospital visits will widen the access to care gap, even as individuals and families are struggling to keep pace with the current skyrocketing health care costs. In my home state of Nevada, this increased tax on device manufacturers would put over 1,000 jobs at risk. We know that this law will cause people to be dropped from coverage plans that they like. I have heard from concerned small businesses in my own district, like Imagine Communications, a marketing firm in Henderson, Nevada, that employs 11 people. When they started out, they paid 100% of their employees' insurance premiums because they saw it as a way to attract and retain quality employees. But due to skyrocketing costs, they have been forced to cut back to only providing 50% of premiums, and they hope they can continue to do just that. But the way things are going, they aren't sure how much longer they will be able to be sustainable. They are looking at having to drop employees from coverage because of the increased cost of providing insurance. As we stand here today, we await a landmark ruling from the highest court in the country on whether key components of the law are even constitutional. The individual mandate, the provision that forces every American to buy insurance or pay a fine, a tax, is the wrong approach to take on health care reform. Instead of penalizing non-action, we should be incentivizing people to take responsible action in making their own personal health care decisions. I stand with the nearly 70% of Americans who want to see this law repealed and replaced with common sense, patient-centered reforms that truly increase access to primary care and help people avoid costly procedures and trips to the emergency departments. Instead of injecting more government into our health care system, our focus should be on patients, especially our seniors, who rely on access to quality health care. Our system is working for most Americans. Almost 85% have health insurance, and it can work for all Americans through common sense reforms like moving coverage towards an individual-based model, increasing competition by allowing the purchase of insurance across state lines, incentivizing the purchase of insurance through tax credits, reforming medical malpractice laws, and letting people, not government, decide what services they need and want. Second chances don't come along very often, Mr. Speaker, but we have before us a great opportunity to get health care reform right. As a practicing emergency medicine physician, I have worked on the front lines of health care, caring for all, regardless of chief complaint, time of day, or ability to pay. I have seen firsthand what works and what doesn't work in our health care system. That's why I've introduced two pieces of legislation aimed at repealing the onerous provisions that hurt individuals and businesses, repairing the elements of the law that have merit, and replacing the broken pieces of the law with reasonable reforms and strengthening Medicare. I look forward to advancing these pieces of legislation in the wake of the Court's decision. We have the best health care system in the world, and we should look for ways to include as many Americans as possible in it. But we also have a duty to uphold the Constitution and pass laws that will achieve their stated goal. The Affordable Care Act missed the mark in both respects, and I look forward to joining my colleagues in delivering a health care solution that will benefit the American people. Again, I thank my colleague from Tennessee for organizing this special order, and I yield back the balance of my time.
Thank you, Dr. Heck. And Dr. Heck talked, as we all know, about the major costs that are involved in this Obamacare. And I want to talk about broken promise number 3. It will not add, and I quote, "one dime to our deficit," close quote. That was a laughable assertion then, and now 3 years later it is clear that it could not be further from the truth. The law will add trillions to our deficit in the years to come. Former Congressional Budget Officer Director Douglas Holtz-Eakin estimates that the law will increase the national debt by at least $500 billion in the first 10 years and over $1.5 trillion in the second decade, not to mention the $115 billion needed to implement the law. That is more than $2 trillion in new debt that will be passed on to our children and our grandchildren. And now I would like to yield 5 minutes to my good friend Mike Kelly, who represents Pennsylvania 3 and hails from Erie, Pennsylvania. I yield 5 minutes.
And I thank my colleague from Tennessee. I really appreciate the opportunity to talk tonight. And I think that I found unusual in my 18 months here is that when I look at a lot of the legislation that comes forward, a lot of it is proposed by people who have never actually done what they're mandating people to do. For most of my life, I was a small business person, still am. And when I get back home and I walk in the district and I talk to the people that are doing the same things that I've done all my life, I'm talking about small business people, they keep talking about the same thing. And the one thing that resonates with me all the time is the uncertainty of what this government does to them, the uncertainty of what this law in particular does to them. And when I talk about uncertainty in business, I mean, you cannot begin to project what your future costs are going to be on legislation that the rules and regs still haven't been put in place. And so we ask people to take this blind faith leap to go ahead and go along with it. The truth of the matter is you can't. You can't when it's your own skin in the game. You can't when it's your business that's at risk. You can't hire people when you don't know ultimately what the cost of those people are going to be. Now people say, well, why is that a big problem? Well, because it drives the cost of whatever it is that you do. Your personnel costs have an effect on whether it's the service you provide or the goods that you provide. So the confusion that goes along with this bill is what puts job creators, small business people, in a quandary. They just don't know what to do because the law doesn't specifically tell them what it's going to cost. Now, again, because I've done it all my life, and it's always been my skin in the game, and it's always been my blood on the floor at the end of the day by making a bad decision, if it was about jobs, if it was about creating jobs, then this legislation surely didn't get the job done. Now, between January of 2009 and April of 2010, net private sector job creation improved by about 67,000 jobs a month. President Obama signed the PPACA into law at the end of March 2010. Since May of 2010, private sector job growth has improved at a rate of only 4,600 jobs per month. And once people get a look at this law, it puts them on the sideline. Once again, a law passed by this House and by the Senate and signed by the President puts the people who really do create jobs in a quandary. And they look at us and they say to us, please do something about this. Please get the government's boot off our throat. I can't continue to plan for the future with a law that doesn't project the total costs. Look, you know, we can talk about this on and on and on, but the American people know better than anybody else the effect that this has had on them. The job creators know better than anybody else what effect this has had on them. People in business who were never at the table know better than anybody else. And now I've gotten to the point where I understand if you're not at the table, you're on the menu. And I got to tell you, job creators were put on the menu. They are getting eaten alive by a piece of legislation that drives their cost of operation up, mandates them to do something under penalty of law or pay a fine that they don't want to do. And you know the funny thing about it, a guy like me, I wasn't given the opportunity. I wasn't given a waiver. Say, you know what, Kelly, I mean, it may not work for you, so we're going to give you a waiver. But who did get waivers? There were some people that got waivers out there. But who were the people that got the waivers? And why did they get the waivers? And so we wonder why the American people don't trust this government and this administration. Why would you trust people that pick and choose winners and losers and say, you will follow the law, you get a waiver? Really? Why? Because we can do it. That's not the America I know. That's not the America that my father fought for. That's just something that's inherently wrong with the way business is being done in this town. So we can talk about this, and we can talk about all the good things and the bad things and the pieces we ought to keep and the pieces we ought to reject, and we can talk about the fact that we don't know what it's going to ultimately cost us. I'll tell you one thing. If you're starting a business now, and people start businesses all over the world, at one time we were number 4, the country that people wanted to start a business in. Now we've fallen way down. And we trail now Macedonia, Georgia, Rwanda, Belarus, Saudi Arabia, and Armenia. It's more attractive to start a business in those countries than in the United States of America? And we wonder why. And we wonder why so many millions of Americans are out of work. And we wonder why job creators, small business people won't hire people. And we tell them you're going to follow the letter of the law or you're going to be fined. And we wonder why they leave our shores and go to other countries. If we're still wondering, we're either poorly informed or in denial. We have made it too hard for job creators to stay here. We have made it too hard for business people to make a decision to hire people. We have made it too expensive for them and leave them no alternative but to stay on the sidelines. So when the President asks, why are these people on the sidelines? Why aren't they investing? I would say, please find the nearest mirror. Look in there. It is this administration and these laws that have put a chokehold on our economy. So I thank the gentlelady from Tennessee for bringing this up. It's very timely. And too many Americans are waiting too long now for answers from a government that just doesn't have the right answers, that tells them the way it's going to be without ever bringing them to the table to ask them, what's the effect of this on you, Mr. Businessman? How badly does this hurt you? Because at the end of the day, it's not about how bad it hurts the business people. There's very little consideration given to us. So I thank you for taking the time to bring this up and for us to talk about it. We need to continue to talk about it, and we need to fix something that is very badly broken. Thank you.
And I thank my friend from Pennsylvania, who is a job creator, and talking about how this bill is affecting our job creators and our economy. And that leads right into my broken promise number 4. It was said that it will not raise any of your taxes. The President's health care law broke this promise with 20 different tax hikes, placing a tremendous burden on the American families and the small businesses, the engine of job growth. Americans are already facing a barrage of Washington-created headwinds, from the avalanche of the new regulations to the impending fiscal cliff on January the 1st. And on top of that, job creators also must work against the velocity of the massive $5 billion Obamacare tax increase coming at them over the next decade. This year, the Obamacare tax burden comes in around $15 billion, as you can see here on the chart, which represents about $190 for each family of 4. But we see it increase by 20-fold by the year of 2040, where the tax burden will be $320 billion, and the amount for a family of 4 will be $3,290. And with the cost of living with gas and food and all of these other crushing burdens on our people, they just cannot afford another increase in taxes. Every dollar businesses are holding back in anticipation of this tax hike or new regulation is a dollar not spent on hiring Americans that are out of work. And with that, I would like to recognize and yield 5 minutes of my time to Rob Goodall, my good colleague from Georgia, from Lawrenceville.
Thank you very much. I thank my friend from Tennessee for
for yielding. And I just have to say, for folks who haven't been following your short 15 months here closely, you know, they don't usually put freshmen on the Ways and Means Committee. They just don't. I mean, this is not a meritocracy. This is an organization that's often run by tenures, a little like a labor union shop. You put in your time, you play by the rules, you eventually get promoted. But when this freshman class came in, and you look at the kind of challenges that we're facing the nation, they looked at folks like you, Ms. Black, who have invested a career in health care, not talking about health care, but implementing health care, and said, where can we make folks the most valuable? And I hear that time and time again back home. Folks say, Rob, why is it all the bureaucrats making all the decisions in Washington, D.C.? And what I get to say to them is, you know, that might have been the way it was, but today we have folks like Dr. Bouchon, like Dr. Heck. We have folks like Diane Black who are in the places where they can bring their real-life experiences to bear. I listen to my colleague Mike Kelly talk about how folks just discount job creators as they're passing legislation like this. You wonder why it is. We're in the worst recession in my lifetime. We have folks who you could consult. We have folks that you could speak with. We have folks whose advice you could seek and employ, and yet Washington knows best. I actually saw your tax chart from my office, and I came down here. I thought that was going to be something about improving outcomes. I thought that was going to be something about how more folks have health insurance today than yesterday. And what I see is, it is a chart of tax burdens. Tax burdens. And now we knew that was going to come. We knew that was going to come because the promise was, within that we were going to provide more care to folks, we were going to do more things for folks, and more importantly, health care premiums for the average American family. They were going to come down by $2,500 per family. That was the promise the President gave us. I see you've brought another chart. I would ask my colleague, what are we seeing here?
Yes, that's exactly what you're seeing here, is the rhetoric versus the reality on premium costs. And we can see that the promise was, we'll bring down the premiums by $2,500 for the typical family. We see, here is the line of the rhetoric, and here is the reality. And we can see that it did not bring it down. As a matter of fact, they're going to continue to go up, and it's estimated by the time we reach 2016, we're actually a little over 2015, the premiums will actually have increased by almost $2,400.
You know,
broken promise.
My concern is when folks see that chart back home, they're not aghast. Because, candidly, that's what they expected. They expected good rhetoric out of Washington, D.C., and they expected abysmal results. And candidly, I don't know why they wouldn't. It doesn't matter whether it's a Republican administration or Democratic administration. Washington, D.C. is famous in its one-size-fits-all solutions for over-promising and under-delivering. But you always have hope. You always have hope that this time it's going to be different. And I remember, I'd say what you want to about hope and change. I remember when the President was rolling out this provision, I thought, golly, if we would just pass this bill 10 pages at the time, there'd probably be some meritorious parts of it. There would probably be some provisions that the American people would want. I might not want them and leave me alone by the world that I live in, but other folks would want them. It passed by 218 votes. If we would only look at it one small part at the time. But there were some ugly things in the bill. Ugly things that I hope the Supreme Court solves and releases to us next week and shares with us. Things that folks wanted to hide in all of these other provisions in the health care bill. And one of the things I pride myself on in this Congress, what we've seen out of the Ways and Means Committee, is we hadn't seen any 2,000-page bills in the 15 months that you and I have been in Congress. We hadn't seen any 1,500-page bills when my freshman colleague from Alabama has been here in Congress. We've seen limited bills with limited ideas that the American people can digest and understand. I know that we can deliver that with the help of colleagues like the gentlelady from Tennessee, with the Doctors Caucus here in this House, the largest Doctors Caucus that we have ever had in this House. I know that we can implement solutions that make sense, 10 pages at the time, in consultation with the American people, not an end run around the American people. I just keep staring at this chart behind you. Promises that insurance costs would go down, and the reality that a command and control government structure has driven those costs up. You know, I was a staffer here before I ran for Congress, and I was here when this bill was being passed. And I remember the phone calls coming in when folks started to say, what's the rush? I'm a Democrat. I'm an independent. I'm someone who wants the government involvement in health care, but what's the rush? I'm concerned that there's something hidden in there that you folks in Congress want to push it all through before we've had a chance to see what's in it. Chart after chart that you've brought down here tonight brings back those memories. That's exactly right. There were things hidden in there. Folks did not know what was in it. But we now have a chance to do it better, and with your leadership on the Ways and Means Committee, I'm certain that we will, and I thank the gentlelady for the time.
Well, I thank my colleague from Georgia for all those kind comments. And once again, looking at this chart, we see the broken promises over and over and over again. And not only the cost to our job creators, which certainly is affecting our economy, but also those to the families, the typical families who are already struggling to get health care. And now we have increased that cost to them by almost $2,400 in just a few short years. Now it is my honor to yield to a gentle lady from Alabama, Martha Roby, who represents Montgomery.
Well, I thank the gentlelady from Tennessee for your leadership tonight on this most important and timely subject, and to the gentleman from Georgia, I appreciate all of your remarks, because I do believe that we have shown through our campaign promises that we were going to put forth legislation that's not just commonsensical, but that all Americans have the ability to digest and understand in a way that gives them the ability to provide feedback to us as members of Congress as to what makes sense and what they're for and what they're not for. And the three-day rule that we implemented certainly has provided us with an opportunity to give our constituents time to learn, so we're not finding ourselves in the same situation as they were in the previous Congress with this massive health care law. And I'm proud to say that one of our first votes in Congress was to repeal this law in its entirety. And most of us can agree that this law has very little to do with the common sense health care reform, but translates into substantial cost, over $500 billion, well over $500 billion that has to be paid by hard-working, tax-paying Americans. And you know, I would think that if this room was filled with colleagues from both this side of the aisle and the other, that what we could all nod and agree upon is that we need health care in this country that is more accessible and more affordable. We just have different ways of getting there. And over the course of this Congress, all of my colleagues here, we've cast over 27 votes to repeal or defund this current law. Soon, and we know maybe sooner than later, the Supreme Court is going to hand down this landmark decision regarding the constitutionality of this very law that we're discussing here tonight. And of course, this, like all of your districts, will affect my home district in Alabama. And regardless of the Supreme Court's decision, I believe that many of the problems that we have with health care in this country will continue to be present, and they have a significant impact on small business in this country. And despite rhetoric, we have a responsibility in this majority to maintain our focus on jobs and the economy, because that is what Americans are concerned about. And today I asked, in anticipation of being here with you tonight, my constituents from the 2nd District of Alabama to share with me on Facebook their concerns surrounding Obamacare. And so I just want to quote a few of my constituents. Obamacare violates the Constitution and the rights of the American people. Obamacare is not the answer. A board of laymen should not decide what treatment I can get. This is between me and my doctor, not some committee without any medical experience. One of their largest fears is IPAB, the Independent Payment Advisory Board, labeled by critics the death panel. Under current law, this 15-member board will be empowered to find cost savings in Medicare by rationing health care services to senior citizens. And you know what? Like the President's czars, this board will be handpicked by the President and will not be accountable to the American people or any person that they elected to the Congress to represent them. One Montgomery, Alabama physician who provides care to Medicare recipients claims that the cuts in payments to doctors will be devastating to his ability just to stay in business. And we know, we've heard testimonies about how difficult it will be to then recruit family practitioners and internal medicine doctors into the community. IPAB's recommendations to reduce health care costs will unfairly and disproportionately fall on physicians just like him, since the law prohibits any reductions in payments to hospitals and hospices until 2020. So many doctors in Alabama are already faced with the painful decision of staying in business or not seeing Medicare patients, all because of Obamacare, not because of the decisions that this Republican majority in this House have made. Not only will IPAB have a devastating effect on businesses, it will have a disastrous effect and negative consequences on a patient's access to care. Another concern of my constituents is the employer-mandated health insurance provision. The Obama administration is encouraging employers to retain and expand health care coverage to their employees by 2014. My question is this: how can a business owner retain insurance coverage if it forces him into bankruptcy? This is what all of us here, when we travel throughout our districts or in district work weeks, this is the #1 concern of uncertainty provided by this law. I recently heard from another constituent who owns independent grocery stores throughout Alabama, employing over 500 workers. This means 500 families are making a living from this business, and when he's required by law to provide all of his employees with health insurance, his grocery stores will go bankrupt, causing significant layoffs to his employees. And when a kumquat producer from a southern state is threatened to go out of business, this is evidence that we have left no stone unturned when it comes to the loss of jobs. On a national perspective, the employer-mandated health insurance provision could cause the elimination of 1.6 million jobs, with 66% of those coming from small businesses alone. Who wins in this situation? No one. Every thriving business that are able to sustain the heavy financial burden of this law are not hiring and growing their workforce due to the uncertainty. As we continue during this 112th Congress, we must remain committed to reforming health care without the threat of new taxes and regulations that burden small businesses and the American people. Congress must be aggressive but responsible and make these reforms as we stay focused on making America strong and prosperous for future generations. I look forward to working with all of you here tonight, and to the lady from Tennessee, gentle lady from Tennessee, thank you for your leadership. It could not come at a more important time. We need to continue this discussion. Again, I cannot emphasize enough that the uncertainty surrounding this law is stifling job creation. And as we are accused day after day of not presenting jobs bills, this is it. This is the #1 jobs bill. When we repeal this law, we will lift the heavy hand of government, and we believe, and I know, that the private sector will, with that certainty, once again begin hiring those people who desperately need these jobs all over this country. Thank you so much, and I yield back.
Well, I thank the gentlelady from Alabama for coming to the floor and giving us some very real situations and quotes from people right back in your district. I was writing them down here. You had folks who were providers of health care, people who are job creators. I'm talking about the patients, talking about whether this is really what our government was set up to do, and bringing these very real situations here so that we can let the American people know how this bill is affecting every segment of our society. I thank you so much for coming, especially with those remarks from the people from your district, because these are the people who are living this and every day having to deal with what is being placed as a burden upon them. So thank you so much for sharing that. That's the purpose of this special order tonight. And now I'd like to recognize my good friend and colleague from Ohio, from Cincinnati, Steve Shabbat, and I yield 5 minutes to you.
I thank the gentlelady from Tennessee for yielding. I also want to thank her for organizing this special order this evening on such an important issue. And none of us knows for sure what the United States Supreme Court is going to do in the next few days, the next week, maybe 10 days. None of us even knows for sure when it's going to happen, but we all, I think, anticipate that it will be soon. But I think none of us would disagree with the fact that whatever they do, it's going to have significant and real implications to an awful lot of people all across this country. And I think it's important to remember how we got into this position, this mess, quite frankly, that we're in right now relative to health care and what happened. The Democrats were in complete control. President Obama had been elected, and they controlled the House and the Senate, and rather than act in a bipartisan manner on something as important as this, which is what they should have done, they should have got input from both sides and done what was in the best interest of the people when you're dealing with something so important as health care. They basically rammed through a bill. Unfortunately, few had even read the bill, as we heard over and over again. And in fact, Speaker Pelosi, who was Speaker at the time, even made a statement that it was important that they pass the bill so they could find out what was in it. What an incredible statement to make. And unfortunately, deals were made to get people to vote for this legislation. The ones that came out that seemed to be the most egregious were maybe on the other side of the Capitol building, in the other body. Some of the things that we heard about there. But this is really not the way the legislation is supposed to happen, especially something as important to people's lives as their health care is. And I think they thought that, in fact, statements were made that the people would like it, they'd fall in love with it once it was passed. Well, that clearly hasn't happened. There was a poll out, a New York Times and CBS News poll that just came out recently that indicates that 2/3 of the American people hope, they'd like to see the Supreme Court either strike down this health care legislation or Obamacare, whatever terminology one prefers to use, but they'd like to see it struck down either altogether or at least in part. And unfortunately, when they focused so much attention on this health care bill or Obamacare, they should have been focused on an even bigger issue, and that's how the economy is so weak and so many people are unemployed. They were back at that time and still are now. And instead of devoting attention where it should have been on the economy and getting Americans back to work, they passed this so-called economic stimulus package, spent over $800 billion, and it did grow one thing, and that's government, but unfortunately did not grow jobs in the private sector. And after passing that monstrosity, they moved to health care and then passed this piece of legislation. It took them basically a year to get it passed. And unfortunately what's happened is it didn't, as you indicated, and I think you did an excellent job in pointing out that what was said and then what actually happened. They said it's not going to raise taxes. Well, it's raised 20 different taxes. They said it was going to drive down health care costs. It's increasing health care costs. They said it was going to create jobs. It's reduced jobs. In fact, it's been a wet blanket over the whole economy. And I've talked to a lot of small business people in my district back in Cincinnati and the greater Cincinnati area, and I've heard over and over again that small businesses are afraid to hire people. They're afraid of the new regulations, the new taxes, and so people aren't getting hired and the jobs aren't being created. And this isn't the only reason, but this is one of the biggest reasons that you hear our small business folks say why they're not hiring folks. And the small business community, about 70% of the jobs created in our economy over the last few decades have been in the small business
sector. And those are the folks that are going to be particularly hard hit by this Obamacare if the Supreme Court upholds it. Now, of course, as our colleague mentioned previously from Alabama, in the House, we passed legislation earlier in this Congress to repeal this bill. But the other body wouldn't take it up, and even if they had, I think most of us speculate that the President would have vetoed it. We wouldn't have had two-thirds to override the repeal. So we hope the Supreme Court acts, but even if they don't, we hope that this body and the body on the other side of the building will act to repeal it. Now, relative to one particular thing, the employer mandate, it's been estimated that has resulted in the loss, or will result in the loss, of 1.6 million jobs if that ultimately is imposed on businesses, that they have to move to this Obamacare. And I think we all know that a lot of businesses are just going to drop coverage altogether. People that have insurance now will not have insurance then if this goes through. We also know there's going to be more red tape. There's going to be more regulations, there's going to be higher taxes, and it's been estimated the higher taxes alone are going to be over $500 billion, $569 billion to be exact. And what is all this for? You know, it's a law that puts government ahead of people. It's a law that consolidates power into the hands of 15 unelected, unaccountable bureaucrats that are going to decide how much of our seniors' Medicare is going to be cut, and that estimate is about $500 billion of cuts also in Medicare. So it's just an awful piece of legislation which we certainly hope the Supreme Court strikes down in the very near future. Now, there were alternatives to Obamacare, things that Republicans have been pushing for a long time. For example, allowing insurance companies to sell insurance across state lines. That means more competition. That drives the cost down so people have more access to health care coverage. Also, association health plans. That means that small businesses can join together in order to negotiate with the insurance companies to have more power to get lower rates for their workers and their employees. Medical malpractice reform. We have far too many doctors that order tests, very expensive tests, just to prevent themselves from getting sued. At least half of these probably frivolous lawsuits. We need medical malpractice reform. And then finally, health savings accounts, which more and more people are finding more and more attractive, saving them money, giving them more control over their health care dollars. Those are a few of the common sense reforms that have been proposed over the years, but unfortunately have been blocked, and they put all their money and all the eggs in the basket of this Obamacare, and I really think the thing is likely to be struck down in the very near future. And the decisions ought to be made by the people back home, around their kitchen tables, people, mothers and husbands and fathers, talking about what's the most important thing in their family with health care. That's where the decisions ought to be made, not in backroom deals up here on Capitol Hill. So, yes, we need health care reform. We didn't need this big government cop-out, really, this monstrosity, this takeover. And I know that some of my colleagues on the other side of the aisle cringe when we say takeover of health care, but that in essence is what it is. Not a complete takeover, but a heck of a big takeover by big government. And that's the last thing we need. So this is bad public policy. It's bad for the American people. It needs to go. And I just want to thank you again for organizing this special order this evening, and look forward to doing future ones and talking with the American people. Thank you.
Thank you, and I thank you for coming here tonight to talk about this program and how it's put a wet blanket on our economy. But not only that, you did talk about some real solutions that really could help to deliver health care, make it more accessible, increase the quality of the care, and at the same time lower the cost. So I sure do appreciate that. Mr. Speaker, how much time do I have remaining?
You have just under 7 minutes.
7 minutes. Okay. Well, I'm going to go quickly to my last points here. In the coming weeks, the Supreme Court is expected to release their decision regarding the constitutionality of Obamacare. And I stand firmly with those 26 states and the National Federation of Independent Businesses who have laid out convincing evidence that this bill seriously violates our Constitution and our founding principles. For the last 3 years, no one has known how or when the court would rule on Obamacare, so the House has worked tirelessly to repeal and defund the law. Because every day this law stands is a day that jobs are being lost, Americans' health care insurance premiums are going up, job creators and consumers are bearing the brunt of Obamacare's tax hikes. And in just 3 short years, the Obamacare has already resulted in fewer jobs, higher health care costs, and more debt. My first act here in Congress was repealing this law in its entirety. Subsequently, I have voted more than 24 times to either defund or repeal Obamacare since being elected to Congress. Unfortunately, these amendments and others like them have been blocked by the Democrat-controlled Senate. But due to the steady stream of broken promises, the growing and unrelenting public outcry, and Republican lawmakers' unwavering determination that we have been successful in getting several of the most egregious portions of Obamacare repealed or defunded and signed into law. And in fact, one of those successes was my legislation that closed the loophole in the health care law and saved taxpayers $13 billion. My bill was signed into law by the President last November. 6 other Obamacare provisions have been repealed or have been funded or rescinded the funding and signed into law, and one of those that many of us will remember is the onerous 1099 tax provision that would have drastically affected especially our small businesses. Now, Republicans are not going to stop here. We will continue to pursue opportunities to get these and other defunding and repeal the bill to President Obama's desk. Before coming to Congress, I worked in healthcare as a registered nurse for more than 40 years, and I have seen firsthand the problems and the obstacles that patients and the healthcare providers face. But Obamacare is only serving to exacerbate the current problems and creates entirely new problems. Repealing Obamacare is a very important first step that must be accomplished, but that simply is not enough. For the past 2 sessions of Congress, the House Budget Committee has produced full repeals of Obamacare and has also set in place a constructive framework to replace the government takeover of health care. House Republicans have built on principles that empower patients with policies that have proven records of success. Now, the House Republican budget passed last year heeds the warnings of economists around the world. The simple truth is that Obamacare is one of the single most destructive things to happen to our economy. We cannot try to micromanage 17% of our economy through a maze of mandates and taxes and price control. Our budget uses models that foster competition, innovation, and choice as driving principles behind improving our health care system. Now, a critical part of implementing real patient-centered reform is Medicare reform. The premium support structure would be a constructive approach to defending and saving Medicare for the current and future retirees. Premium support would reflect the structure of the overwhelming successful Medicare Part D program. Now, Medicare's prescription drug program is succeeding beyond all expectations. It's delivering needed prescription drugs to the Medicare beneficiaries at a lower cost than expected due to the strong competition, yes, competition among health care plans that work to keep costs down and negotiate with pharmaceutical companies for savings. This market-based program is seen by policymakers as a model for how to restructure health care entitlement programs. The CBO estimates show that Part D is costing far less than the initial projections. Total costs to Part D are now estimated to be 43% lower than the initial projections for the initial 2004 to 2013 forecast period. And according to CBO Medicare Part D baselines for 2004 to 2012. In March of 2012, the CBO reduced its Medicare Part D spending projection from 2013 to 2024 by $107 billion. This was due to an increase in the number of high-volume drugs with generic substitutes available and changes in the drug utilization. At the same time, CBO increased its projected spending for the rest of Medicare. Now, let's take a look at the average beneficiary Part D premiums in 2012 are far below the original projections. As a matter of fact, you can see here on the chart that the average monthly beneficiary premium for Part D coverage is about $30 in 2012, virtually unchanged from 2011 and far below the $56 forecast that was originally projected. According to the former CMS Administrator Don Berwick, these consistently low premiums, and I quote from him, are going to make medications more affordable to the Medicare beneficiaries. And CMS officials reported in 2011 over 99% of Part D enrollees had access to the plan with a premium that is the same or lower than their 2010 premium. And you can see that very clearly here on this chart of what the projections were and what the actual amount is coming in. The same amount of the premium in 2011 and 2012. Just remarkable. Now, research shows that increased access to medication achieved through Part D is actually lowering beneficiaries' health care costs. A new study in JAMA found that the implementation of Medicare prescription drug program was followed by a $1,200 per year decrease in non-drug medical spending among those who previously had limited drug coverage, which has been reported to generate over $12 billion per year in savings to Part D from less use of hospital and skilled nursing facilities. As a matter of fact, what this has showed is because patients are receiving their medication, can afford them, they are not going to the hospital as much, therefore saving costs. Beneficiaries are also highly satisfied with Part D. Recently released surveys showed that Medicare Part D enrollees are overwhelmingly satisfied with Part D coverage. 88% of the Part D enrollees are satisfied with their coverage, and 95% say this coverage works well. Additionally, vulnerable beneficiaries who are duly eligible for both Medicaid and Medicare exhibit the highest satisfaction. Now, should the High Court fail to overturn the law or sever parts of this disastrous piece of legislation, the House Republicans will continue to fight to defund and repeal Obamacare. While the country continues to suffer from failed policies and broken promises of the Obama administration, my Republican colleagues and I will not only continue to undo the damage, but we will also rebuild a health care system that puts patients and their doctors in the driver's seat rather than the unelected bureaucrats here in Washington, D.C. Mr. Speaker, I yield back the remainder of my time.
The gentlelady's time has expired. For what purpose does the gentleman from Georgia rise?
I move the House to now adjourn.
The motion is, I'm sorry? Could you repeat your motion?
I move the House to now adjourn.